So good afternoon, everybody, and welcome to our third webinar in our Lunchtime webinar series. Today's session, we're going to be taking a look through our Clinicians View solution. Clinicians use a dashboard which aids consultants in managing outpatient appointments and consultations. It's been created with simplified, easy-to-use viewing panes with a user-friendly interface and provides the most relevant information in the right time, helping complete clinician tasks more efficiently. So before we jumped into our live demo today, I'm just going to take you through a few slides just to introduce who we've got working with us today. So I'm going to be your presenter today. So I'm the Customer Account Executive at Heaver. As well as myself, we've also got James Brynan, who's our Deputy Development Manager. He's going to be working on our Q&A panel in the background today. And we've also got Holly Johnson, who's going to be our producer today. So she's our Marketing Executive at Heaver. Just to let you know before we get going, cameras and microphones will be switched off for today's session. The reason we've done this is we do have a Q&A panel available. So if you've got any questions, please feel free to put them in the chat. You should be able to find that you can get to the Q&A panel just from your Teams bar at the top of your screens. And just to let everybody know as well, we are recording this session and we will be putting it up on YouTube afterwards as well. So I'm going to jump into our live system now just so we can have a look through Clinicians View. So what I've done is I've just logged in as one of our clinicians, which is Dr. Wilson, as you can see down in the bottom corner here. So what we're going to do is we're just going to we're going to walk through a patient appointment today. So in Dr. Wilson's area here, you can see we've got a little Clinicians View tile. If we go into that, you see we've got a patient sitting ready. So at this point, you can see that Zane Loan's been checked in. We can see on his status on the reading pane on the right that he's arrived. What you'll be able to see on the status columns at the top here, that you can actually filter down by whether you want to see the due patients, whether they're waiting, as well as in progress, completed or cancelled as well. So if we just have a look at a few of the others that we can see that have got them in. You can see when we click on them, they just turn a different pink colour to show that they've been selected. And I've also got a tick in the bottom right-hand corner as well. You can see that's just updated our column in the middle here. So we've got Zane Lowe, which has got the status of we're just waiting for him. So he's been arrived and it's just waiting for his appointment. You can see we've also got this one at the bottom here, which is the cancelled one. So again, if we tick off of these, you'll see it just filters down by that. So clinicians can filter to that level if they want to. As well as that, along the top, you can see we've got a clinician at the top here. So this is Dr. Wilson, which is the clinician we're signed in as today. And you can also see there's a rooms tab at the end here as well. So what they can do is if they've got multiple different appointments in different rooms for that day, you can also filter down by that as well. If I just click onto the due here, you should see. So what that's done is it's just brought in consultant room 52 as well. So if they've got quite a lot of appointments in their Clinicians View screen, you can filter it down by room as well. That's another option. In terms of other things on this main screen, the first one I wanted to look at was the filters panel on the left here. So if we just open that up, there's only one thing you can currently filter by, and that's the date. So you can, if we just clicked on the 15th, that's going to bring up today's bookings, which is what we've got open. If we go up to top right here as well, you can see in the app settings, we've got a couple of settings here. Similarly to other screens in Compucare, you can change the reading pane position. So you can put that on to the bottom or the right or switch it off. We've also got this auto refresh toggle as well. So I've got this selected to on to make sure that this screen keeps auto refreshing. And we've also got the ability to select the refresh rate down the bottom here as well. So you can see we've got 3 different options. They're all quite quick speeds because, of course, if you've got patients checking in quite regularly, you'd want this screen to be updated quite regularly as well, so you can see it in real time. Perfect. Just at the top here, we've got a couple of extra options. We've got one option, which is to update the patient location. If we just have a look in the reading panel on the right here, you'll see that Zane Loan's current location details is the main hospital reception. If we click into the update button on here, it would just give you the option to update their location. So if we just said, if we put him in the outpatient department at the moment, it's just going to update those details at the bottom of the screen and put a recorded time on that as well. So that's the first thing you could do from here. We've also got a review results button. So if we click into that, what this is going to do is it's just going to give you a bit more information around the patient's results. So this is linked into different modality types. You can see at the top here, you can filter this down by which modality type you wanted to look at. So if we just wanted to have a look at the MRI machine one, for example, it's just going to filter down those results for you, so you could just see what you want to have a look at for previous historical results. If we click into one of these, you can see we've got an MRI hip one here for the on the 8th of the 5th, 2018. What it'll do is it'll give you the ability to open the report. So if we just go into that, it's just going to bring up that print preview screen that, again, you've seen this probably in quite a few of the Compucare screens already. So you can see the report that's been written about this one. You've also got the ability to view the PACS imaging on that as well. So that is another option you can do as well. You'll see on the left-hand side here, there's a couple of different icons. The first one's a clock. That's just suggesting that the order has no report or results yet. And then you've got the tick as well, which suggests it does have a report against it. If we just have a look into the blood sciences results, there's a couple of extra things we can do with these. So you can see we've got some blood science results that's been reported for our patient yesterday. What it'll do is any numerical results that you enter into the enter through forms into the Clinicians View solution, what it's going to do is it's going to give you the ability to go through historical viewing of those. So if we just select one of these blood count results, if we have a look at the hemoglobin, for example, what it's going to do is it's going to bring up a chart where it gives you the ability to look through the previous results that they've had for blood counts. So it'll let you have a look through the previous results, which you can select and have a look at. And it also provides this data as a graph at the bottom as well. So you can track how the hemoglobin and different results have formulated over time. So that's something else you could do as well. Any numerical results that you could put into Compucare, you can do this. You can also see that at a quick view, any that have got any that have got warnings against them or anything like that, it will just highlight that up, so you can see it's put it in a red colour. And it's also got an action at the end there, so it's just suggesting that that's a low hemoglobin result for this patient as well. So I'm just going to come back out of that screen. In terms of other bits on this main screen, you can see we've got our reading panel on the right-hand side here, similarly to a lot of other screens in Compucare. What this is going to do is it's just going to give you a bit more information around their episode of care details. Again, it's just going to give you the status of the booking, so we can see that this one's been checked in and they're just waiting for their appointment to start. It's going to give some details around the start time of the appointment, how long it is, and consultant details as well. And then we've got some billing episode details as well at the bottom here, so we can see it's a self-pay patient. There's a couple of things we could do from the main panel in the middle here. So there's a little patient toggle at the top here, and this just changes the level of detail that you can see on the screen. So if you didn't want to see pictures and address details, you can just reduce that down by pressing the little subtraction button there. So if we take that back up, as well as that, you can do quick actions for the patient as well. So if we just click on Zane Lowe's tile there, you can see that it brings up a sub-menu. From there, we can have a look at patient details, and we can also do things such as adding alerts, looking at attachments, notes, and timeline as well. I'm not going to jump into all of these. We're going to have a look at a few of them a bit later in the demo, but just have a look at one of them. If we clicked on the timeline there, what that's going to do is it's going to bring up a patient timeline on the right-hand side. In here, you can see we've got a few extra details, and it just gives you that historical data about the patient as well. So if you scroll through here, you'll see various different things. You can see we've got those the blood results that we put in, as well as any forms that we filled in for the patient. They've got any previous appointments in there as well, so you can see we had an appointment for yesterday for this patient. Those are the blood results that we've just had a look at that were put into this patient's records. And there's also anything such as referral letters and episodes of care in there as well. So you can see all of that straight away from the patient timeline in this initial screen. So that's everything I wanted to show you on our initial screen. So obviously the next part of the appointment is actually going into the appointment. There's two different ways we can do this. The first one is by clicking the play icon on the side here. And then you can also double click this line and that'll take you into the appointment as well. So if we just start up Zane's appointment, that's just going to bring up a new screen. So you can see it's brought up a complete appointment screen now. So there's quite a lot going on in the screen, and we're just going to have a run through that. Firstly, again, from the top, you can again get into this timeline view on the side, so you can do that straight away from the appointment. It also gives you the episode of care information underneath here as well. And then underneath that, what we've got is we've got a default form for this clinician. So I've just set up a default form that's called Bloods and CT Hip for Dr. Wilson. And I've put a few different things in here. So before we get going, I just wanted to have a look very quickly how you set up default forms for clinicians, and then we'll jump back into this appointment. So if I just go on the bottom icon here and just click on Edit Person to go into Dr. Wilson's record. If you scroll across to the Clinician tab, you'll see there's a section here that comes up with default first appointment form as well as default follow-up appointment form. So you can see for the appointment that we're in at the moment, that's a follow-up appointment. So it's defaulted in that Bloods and CT Hip that we're having a look at. So that's where you can set that up for your clinicians as well. So if we come back out of that, I'm just going to run through this form. We've got a couple of different opponents which have come out in new builds that we've released recently. So you can see we've got the date and time stamp, which I've put into this form. So the newer facilities that we've added to forms is the ability to now add service requests straight from forms. So you can see we've got a full blood count and a CT hip here. What we're going to do is if we tick onto those, that's going to give the clinician the ability to request those as soon as this form's been signed off. So we'll select both of those to on. The other ability we've had is the ability to put patients straight onto waiting lists from forms as well. So you can see we've got this next box at the bottom here, which just asks if pre-op physio is required. I appreciate this example might not flow with each other, but it's just to show you the different things we've added in the latest builds. So if we clicked on the pre-op physio required, what that's going to do is it's going to put the patient straight onto a waiting list for that. So that's something you can now do from forms as well. You can put them straight into waiting lists as well as the service requests as well. I'm just going to fill in a bit more of the mandatory details that we need for this form. So if we just fill in some of the blood pressure information, and if I'm just going to put NA in that comments box at the bottom. And then at the bottom of the form, you've got the ability to add any actual procedures that have happened during the appointment. So you could do that here by just clicking the little add icon. And then you'll see there's an appointment details section at the bottom. So in the appointment details section, this is where you're going to put any findings that you've come across during the appointment. You can see from the little wand at the side here, this is a smart text box. So you can type anything in that's in the clinical dictionaries in your system, and that'll just bring up the full text for you. So we can do that in there. There's also this field at the bottom, which is the outcome field. So in here, in the outcomes table in your Compucare system, you can set up different outcomes, and you can set up the required submenus that it's going to come up with once you select those. So if we just have a look at one here, I'm just going to look at the requires inpatient booking one. You can see this has brought up another submenu at the side here, and it just gives you a few options. So at the top, there's the option to how many days you wanted to defer it, and any waiting list notes you wanted to put in. What this is going to do is it's going to drop them into the requires inpatient booking waiting list. There's also the ability here to put in any waiting list procedures. You can see this is a mandatory field at the bottom. So this is something we've put in just because it allows the clinician to actually put the procedures in themselves. So this reduces the risk of clinical error or anything like that, because it just reduces the amount of people looking at it. Usually admin staff or medical secretaries might be putting this information in for them. So if we get them to do it while they're doing their appointment, it just adds best practices in there as well. So if we just put a procedure in here, I'm just going to put this repair of abductor mechanism of the hip in there. Again, you could add any notes in that you wanted to in there, and it just asks you for the procedure site and laterality as well. So I'm just going to put that this is for the left hip. If we add that in, you can see that's just dropped into the bottom there as well. What I'm going to do is when we've completed this appointment, I'm just going to drop into the waiting list screen just so we can see how both this outcome field has dropped into a waiting list and then how this pre-op physio has dropped into a waiting list as well. So we will take a look at that as well. As well as that, in this field, I just wanted to have a look at this little to-do box you can see on the right-hand side. So this is extra functionality we've got in the Clinicians View. It's worth noting that these tiles will only be available dependent upon the Compucare modules you have in your system, as well as your clinician security level. So not all of these might be available to all clinicians, so it's worth bearing that in mind. For all of these tiles on the right, what you'll notice is when you click on the actual tile itself, it's going to take you into the history of that section. And then if you click on the little plus icon at the side, it's going to add any new information you want to add. So that might be information you found out during this appointment. I'm not going to run through all of these, but if we just have a look at the allergies one as an example. So if I click into the tile, you can see it's come up with some previous allergies for Zane Lowe. It's got in the alerts panel here. So we've got this one here at the top. And then if I come back out of it, and if I just click into the little add button at the side there, you can see it's taken us into a different screen. So this gives you the ability to add the alert instead. So if we keep that as allergy type, and if we just check the aspirin one there, and if we save that off and click back into the tile again, you'll see that that's automatically updated. So any information you're gathering during the appointment, you'll see that that updates whilst you're going through the appointment, and it does live update that as well. Similarly, for example, you could come up with examples of medication history there. So if the patient told you, actually, we've been taking some medication as well, you can fill in those details. So if we just said they was taking aspirin, for example, it's just going to ask you for that information source. So we say that's the patient's told us that during this appointment. There's a few other boxes that you can fill in here, and it just gives you options to add the start date and end date. So if we say that they started this on the 3rd and finished it on the 10th, which is what they've told us, you can add any notes in there as well. Again, if we save that off, that's going to drop into their medication history as well. So you can see it's added that one in where we put they started that on the 3rd and any details about that in there. Perfect. So what I wanted to do now is that's everything that I wanted to show you on the main complete appointment screen. If we just save that off, what it's going to do is it's just going to come up with a post actions box as well. So it gives you the ability to go back to the home screen, and it also gives you the ability to add any patient charges as well. So you can do that from the Clinicians View as well. I'm just going to click finish so it pulls us out of the appointment. And what I'm going to do now is first I'm just going to have a jump into the outpatient booking screen on Dr. Wilson's area. And if I just filter that down to today on the 15th. So what we can see is it's dropped in that appointment. So this is Mr. Lowe's outpatient booking details here. And we can see that appointment's been completed now. So as you can remember on our form results, we had the ability for the bloods and CT. You can see that it's changed the status of the form to signed off, and it's also just separated out what we need as part of that as well. So we've got the full blood count, and we've also got the CT without contrast as well. So it's just letting us know that they need to be done as part of the form results that we pulled out. If we just drop into the orders panel, you can see that that's glowing at the top there as well. You can see that for both of these, again, it's split them out. So we've got that CT hit that we checked in the appointment and the full blood count, and it's just changed the status of these to requested. So you can now book the separate appointments for these as required to fill in the results as well. As well as that, the very last thing I wanted to show you is if we just drop into our waiting list entries, just so we can see what it's done with those. Again, if we just filter down by today, just so we can see the appointments that have come through. So we can see there's a few different waiting list entries that have been added today, and this is as a result of the appointment that we was looking at. So the first one at the bottom here, this has added Zane into physiotherapy required. If you can remember, that was the tick box that we ticked at the top of the form, just saying that they needed physio pre-op. So it's dropped him into that waiting list. If we have a look at the one above it as well, you can see that's that inpatient booking required as well. So that was the outcome field we filled in at the bottom of the screen. It's dropped him onto the inpatient booking waiting list, and you can see we've got those procedure details that we filled in as well down here. So it will add all of that in for you as well. Perfect. So that's everything I wanted to show you today. That brings us to the end of our webinar today, and thank you very much for joining us. Hopefully you found the event useful and made use of our Q&A if you needed it. If you've got any further questions or queries, please feel free to get in contact. I've just put the details up on the screen there. And thank you very much for watching.